Hi, everyone. My name is Pervez, and I am blessed to share my perspective with all who is attending this summit. And I will be talking about impact of COVID-19 on Hep B and TB services. And just a quick glance about myself, like I am TB survivor and I am currently going to Hep B services, though I'm not on the medication, but I have been like diagnosed as happy person. So next slide, please. So before going into the detailed presentation, I just want to give a context, and I'm sure the earlier presenters have also shared this, but quickly, like approximately 72% of total detected global cases occurred in the first 6 months of 2021 alone, which actually given rise to poverty, increasing gender-based violence, human rights abuses, which are a couple of the highlights. And the challenge is basically this actually placed an extraordinary strain on health system, especially where mobility and other government restrictions have interrupted essential health services. And among those, vaccine and treatment have been developed and approved for emergency use at an extraordinary rate, but it excluded China, Brazil, and India. And this increases the access to vaccine approved, authorized, or listed by stringent regulatory bodies. Vaccine confidence and misinformation remains a significant concern of everyone. Next slide, please. So many people with TB, HIV, HCV, and HBV left behind without access to diagnosis and proper care, and the diversion of resources created problem. This actually created problem, especially for those who are suffering with the TB and Hep B. So as per the global report by WHO, it says that TB targets will never be met. And this is putting everything on halt and or everything is paced down slow. And the first time in over a decade, TB deaths have increased because of the reduced access to TB care during the pandemic, and it reversed years of progress made in the fight to end TB. And another key challenge for the community, especially who are suffering with the disease, number of missing people with TB has increased. And because of this, that COVID had disrupted health services for HIV, HCV, HBV, and other diseases, and number of missing people with TB has significantly grew up. And one of the study conducted by an organization, let me see, according to the World Hepatitis Alliance, they conducted a survey, and based on their survey, only 33% of all 132 respondents reported that people were able to access viral hepatitis testing. 46% reported being closure of testing facilities, and 34% on treatment for hepatitis were unable to access their medications. So it was equally affecting other services, including the services for the people who are suffering with Hep B. And investments have fallen as well. Resources for TB have moved to COVID, and 2022 is the year of the UN high-level meeting and will be falling short of many targets. This is, as per my perspective of as being a TB activist, this is really a grave concern of all TB activists, that TB resources, including financial and human, are moved to COVID services. And this is putting most of the TB services and the people who are suffering with disease at far behind. Next slide, please. So this specifically created an impact of key population, vulnerable communities, which are suffered with limited or denied social, behavioral, and economical indicators, especially negligence of TB diagnosis under COVID cover. When I say this, I had already talked about many of the people who have been suffering with other diseases. They are probably ignored because they assume that they are having COVID, and their proper diagnosis remained under challenge. And another thing is COVID denied and widened gender equality gap, and women and girls are the verge of verge of the suffering. And just to highlight, I'll come back. So immediate shock of mobility and the seize of economy limit diagnosis, treatment, and care. Delays in vaccine access will cost lives and money. Political upheaval has had similarly detrimental effects on the COVID. Next slide, please. So regarding to how we can address all these challenges, we have a couple of the best practices which is implemented across the world. The first thing first is COVID is not at all be treated by one single approach. We need to have multiple approach or integrated approach. And a couple of the innovative ways could be community engagement, innovative use of science, technologies, and innovations. Also, TB 33% campaign, I will explain a little later. The wider dissemination of proved scientific knowledge, including all IEC. We community activists believe that we don't need a fish. We want us to teach how to catch the fish. We don't want to have resources in a way like get this and do this. We want to get trained and we want to know how we can overcome all this by ourselves. Next slide, please. So when I talk about community engagement and empowerment, there are many successful approaches, especially the peer-to-peer approach. And pandemic has, however, actually shown a light on the importance of community engagement in public health. And one of the suggestions which I always highlight wherever I talk about, reach out to covered COVID, TB, HCV, HBV, and HIV survivors, community activists, and engage them in knowledge dissemination, contact tracing, and access to services by bridging communication, travel, and services gap. And this is a proven fact that wherever we engage communities and get their services as the activist or service provider, they always help the health system to bridge the gap and also help the service provider to reach out to the people who are not in the system. And this is very helpful, especially for the contact tracing. Because if we have someone who has gone through the same experience and who is living in far away communities, he or she can act as a resource person and help the health system service providers to bring those back who are missing from the system. And organization and service providers can promote different kind of successful initiatives, and couple would be cash for linkages building. For example, if someone is acting as a person who is living in the community and helping system to bring the people back, he or she can get some cash for this linkages building, and he or she can also have cash for referral and cash for health service delivery system led by the communities. And it is always a fact that empowered community will lessen the burden on healthcare system and professionals. Next slide, please. So there are many global community engagement initiatives all across the globe. If I talk about specifically, there is a global community task force. There is Stop TB Partnership Community Delegation Board and representative. There is a community focal point. And if we engage them in TB, HBV survivor leadership development process, they will be helping us in educating TB, the HBV survivors, and they can become activists and they can advocate and campaign for the transformative challenges, which is basically helping the system to reach out to those who are not in the system. And we as a community activist believe that nothing us without us. If we are not involved, if we are not part of the process, if we are not part of the system, services might not be reached to those who deserve services. Next slide, please. And innovative use of technology, that's really, really important. The COVID-19 taught us innovation. Because of lockdown, tremendous advances have been made in the area of telehealth, remote service provision, use of call center, e-pharmacies, use of digital adherence, technologies, home delivery, medicine, a lot many other. In the short term, to restore TB, HIV, HCV, HBV services, we must invest more resources in technologies to leverage COVID-19 technologies and systems that can be effectively used to tackle healthcare and get it back on track. And thanks to the pandemic, great use of the expanded molecular testing capacity now exists in almost all countries. All of these can be and should be leveraged for TB, HIV, HBV, and HCV at a larger scale than what is currently happening. And another thing which I want to highlight is Gene Expert Omni instrument is a great source that can be give access to diagnosis and proper care for many people with TB, HIV, HCV, and COVID-19 in no time. Next slide, please. So there are a lot many technologies which we can use, and WHO has compendium of 24 innovative health technology for low resource settings. There is UN Innovative Network. There's a COVID-19 Innovative Hub. There is Gene Expert Omni instrument, and virtual communication and conferences tool are a great source of technology. Next slide, please. Next slide, please. Next slide. Next, please. Just want to highlight what this COVID-19 Innovative Hub is. This is a hub to browse innovation identified for their COVID-19 efforts or view all potentially relevant COVID-19 innovations from across the globe. And it is available on WHO website. If someone is interested, he or she can have access to that. Next slide, please. This I want to highlight, and we are advocating for TB 33% campaign, and HIV having 50% resources, malaria having 32% resources, and TB having only 18% of resource from the Global Fund. And we believe like TB is contributing a huge amount of sufferers who are suffering with the COVID and TB. So people with TB demanding that this budget should be equally distributed, and TB should be getting 33%. And this should be equally distributed to HIV and malaria. Next slide, please. And proven and scientific knowledge, we experience that COVID has many myths spread by many people. There is a need to have scientific knowledge that should be distributed amongst the people who are suffering. So the COVID services should be accessed by everyone. Next slide, please. And communities, as a community, we believe like the community with TB are concerned because we lost years of progress, which took us billions of dollars, billions of person hours to achieve, but the world doesn't give a damn. TB is an ancient, distinct, boring, not profitable, and not killing people in the West. So TB is not at over the news. After engaging number of healthcare workers and spending trillions on COVID-19, we are still struggling to control COVID. Interestingly, most of these healthcare workers and trillions are relocated from TB funds. So we are demanding that TB 33% engaging communities. So there should be equal distribution of resources. Next slide, please. Next slide. So our hope. Last month, President Joe Biden convened heads of the state and leaders from diverse organizations for the Global COVID-19 Summit. And a key target announced was to vaccinate at least 73% of the world population by this time next year. Meeting this target must be a priority for all countries. Vaccinating the world is the best hope for ending this global crisis and for recovering TB and other health services, including HCV, HBV, and HIV. And we believe every breath count, every penny count, every person count, and especially tackling TB, HBV amidst COVID is demanding action and action now. Thank you very much.